I would say I was most excited to see some of the prospective doctors that are looking to learn more about OMS 360 so that I can kind of share my experience so far as to what it's looked like the past year and relay that information to them. A little bit of extra motivation, a little extra inspiration, a little extra energy to return back to our practice to provide the care back toward the patients so that, a little extra pep in our step. So I would say early on in partnership, Trevor, our CEO, came up and we met with our implant team with ZimV, and they decided to let me go to a course in Florida where I learned a little more advanced techniques with immediate implant placement and being able to relay that newly acquired procedure back to patients was a good full circle moment. Yeah, it's nice, having a lot of doctors, a lot of different brains to pick, a lot of different backgrounds to learn from. Dr. Everett has always taken a little bit of extra time to even just over the phone talk about, if you're going to do an immediate molar here, try grafting, certain techniques and certain closure techniques that have helped. So I'm not very much of a control freak, so it wasn't very hard for me to let go of certain things. But I would say that the thing that I was most happy to let go of was some of the HR side of things. So anytime we have any type of employee disputes or conflict within the office, it's really easy to just say, hey, I have a dedicated HR team led by Amanda who can help come up with a solution here. My role as a surgeon is much more intentional now, where before it was just going through the motions, but I truly believe that with the support of OMS 360, it's allowing me to be more intentional on providing as best patient care as I can. I mean, I had time for him before, but I'd certainly have more time with my family and kids and two young ones at home. It's a lot nice to leave work at work now and spend more time with them. Doctor led means to share some responsibility, but also know when to allow my office manager to lead. So I think provide a little bit more of an oversight as opposed to being actively having my finger on every single thing that goes on throughout the day. So I can focus on patient care and I can allow my manager to manage. Kristen Leary actually very much surprised me. So she's the integrations lead. So she comes for the first 12 weeks for all the practices whenever they join OMS 360, and she, was very relatable to all of our staff. She walked through them, all the changes that we went through. She walked them through, step by step, and was very relatable to them, and just was great with our staff. So we struggled. As I mentioned, I was getting more comfortable placing immediate implants, and I was having patients come in, and I wanted to offer the service to them, but they weren't mentally prepared for the option. They weren't financially prepared. So we were able to provide a solution where we identified these patients on the initial patient phone call, so that we can screen for them and give them more of a heads up of this may be an option for you, and if this is an option, this is what the ballpark financial figure would look like. So that was a big success for us. I'm a doctor one of five in my group, and we always say that we talk now more than we did before partnership, even within my own circle. So certainly more collaborative, certainly more picking each other's brains and trying to figure out the best way to do things. So the change is it's broader, it's more informative and more collaborative. I would say it's very intentional on trying to improve every day. So there's just a large focus on making the patient journey better for the patient. So a better patient experience and a better work environment. I think people think that it's a one-size-fits-all solution, and that's certainly not the case. You know, every practice has a tailored, or at least in our case, we have a very tailored approach where, you know, we do what's best for our practice, and it may not be what's best for different practices. So I think, you know, the stigma is it's a very one-size-fits-all, and it's much more tailored approach. We're still learning which staff members do which roles, so delineation of tasks between the different departments within our practice. And we constantly are communicating with our regional manager and CTS so that they can understand what our pain points are and how to fix it. So I think we're finally starting to get figured out where exactly each member of our team excels best. It's more focused on the patient as opposed to the outcomes and the, you know, the financial side of things. It's you know, good. They always preach that good medicine is good business, and you know, almost all of the attention and all of the intentionality that we place on is on the patient experience. Excited, yeah, super excited. Certainly a lot of positive things moving forward, and just excited. I would say before MS 360, I was kind of going through the motions of my day-to-day. Now I'm much more intentional on trying to improve myself, trying to improve my team around me, trying to improve the overall patient experience. Just continued growth, continued success, trying to get better each day, and you know, continue to grow each day.